Hi, my name is Kaylee Fales, and today I will be demonstrating some special tests of the foot, ankle, and lower leg. I will begin by completing the Potts compression test, which would present as pain at the fracture site if it is a positive test, and the associated pathology with that would be a fracture. So you will start by compressing away from the suspected fracture site, and you can compress the tibia and the fibula together at different locations and look for signs of pain, or you can ask the patient if there is pain. The next test I will be demonstrating is a long bone compression test. A positive test result would look like pain at the suspected fracture site, and the associated pathology would be a possible fracture. And this will look like compressing the bone, a long bone at the proximal and distal ends, to see if there is a pain response at the suspected fracture site. So you can compress at the distal and the proximal ends and compress and watch for pain responses. This next test is called the vibration test, and a positive result with this test would be pain at the possible fracture site, and the associated pathology would be a fracture. And with this, you can use a tuning fork to vibrate the bone, and it will either cause pain or not, depending on the pathology. So for our purposes, we'll pretend that this brush is a tuning fork. So you will bang it against something, and then while it is vibrating, you will put it away from the suspected injury site, like this, and see if any pain occurs, and then you can move it closer to the associated injury site and see if there is a pain response. Next test is the percussion test, which is used to identify a possible fracture, and a positive test would look like pain at the suspected fracture site. For this test, you can tap above, below, and around a suspected fracture site to see if a pain response is elicited. This next test is the anterior drawer test of the ankle, and a positive test would look like laxity, and it would be measured bilaterally, and the associated pathology would be a tear of the ATF or CF ligament. So in the anterior drawer test, you are going to stabilize the tibia and the fibula. You're going to come to about 20 degrees of plantar flexion, and then you are going to pull up and watch for any laxity in the ankle. And you will do this bilaterally. This next test is called the Taylor tilt test, and this is used to see if there's a tear in the deltoid or CF ligament, and a positive test would look like laxity, and it would be measured bilaterally. So for the Taylor tilt test, you are going to take the patient's foot, you can stabilize, and then you're going to invert the foot, and so inversion and evert the foot, eversion of the foot. And you'll do that bilaterally, and you will check for laxity. The dorsiflexion maneuver test can be used to help diagnose a high ankle sprain, and a positive test would look like pain over the syndesmosis. So for this test, we are going to have the patient supine, and then you are going to slowly dorsiflex their foot, and a report of pain would be a positive test. The Kliger test is used to help diagnose a sprain of the CF ligament, and it would look like and a positive test would look like laxity on the side of the injury, and it would be measured bilaterally. In this Klager test, you are going to have the patient's foot in a neutral position, and then you're going to internally rotate the foot and externally rotate the foot. And you're going to check for laxity bilaterally, so internal rotation and external rotation. The squeeze test of the leg can be used to help diagnose a high ankle sprain, and a positive test would look like pain over the syndesmosis, and it would be measured bilaterally. You're going to compress the calf above the midpoint and watch for plantar flexion of the foot. You don't need to see me.
Okay.
The Thompson test can be used to see if there has been an Achilles rupture, and if there is, the positive test would look like no movement in the foot. For this one, you'll squeeze the calf, and if the Achilles tendon is intact, you'll see plantar flexion of the foot, and if it is not, the foot won't move. A positive Maddles test would look like a foot in neutral or dorsiflex position, and the associated pathology with that would be an Achilles rupture. So for this test, you're going to have your patient supine and bring their knee into a 90-degree flex position, and you're going to watch to see if their foot falls into a neutral position or dorsiflexed, and if it does, that is a sign that the Achilles tendon has ruptured.